Hi, my name is Hannah Gould, and I'm a licensed EMT cadet in the state of Massachusetts. Because I work in a pre-hospital setting, it oftentimes means that I have to find different ways of properly determining how to treat a patient. And one of those ways is through vital signs. AFPU, pupils, blood pressure, respiratory rate, heart rate, skin quality, color and condition, pulse oximetry, and blood glucose levels. Now to start off, to take a vital sign, you have to observe trends. And to see a trend, you take a vital sign at least 3 times. 2 times allows for to be seen a change, not a trend. So we always take them 3 times. To start off, we have AVPU, alert, verbal, painful, and unresponsive. This guy is telling us that he is conscious without any prompting, so that means that he is alert. Pupils, we want to see pupils that look just like his. Pupils equal and reactive to light, equal in size and equally reactive to light. For blood pressure, you read it systolic over diastolic, or the amount of pressure in the arteries during a contraction of the heart over the amount of pressure in the arteries in between heart contractions. And a perfect range for this for adults is 120 over 80 to 140 over 90. For respiratory rate, it's the amount of times you breathe per minute, or the amount of times that oxygen gets flooded into your lungs. And a perfect rate for that is 12 to 20 breaths per minute, BPM. For heart rate is the amount of time that the heart beats or contracts during a minute, and a perfect rate for that is 60 to 100 BPM, this time beats per minute. Blood pressure, respiratory rate, and heart rate oftentimes work together. In Cushing's triad, which is a rare phenomenon due to increased intracranial pressure, you'll often see a blood pressure rise, a respiratory rate become irregular, and a heart rate decrease. But in a heart attack, when you feel the pain up your arm, you will often see a blood pressure decrease, a respiratory rate increase, and a heart rate increase as well. For skin color, quality, and condition, you want someone to look like you. So you don't want to see someone who is green or is slightly blue or really, really sweaty. That's not very good. For pulse oximetry, you want to make sure that the percentage of oxygen in your hemoglobin in your bloodstream is above 94%. That's the state regulations in Massachusetts. For blood glucose is the amount of sugar in your blood at a given time. So you want your range to be about 70 to 140 milligrams of glucose per deciliter of blood. These all will change very, very rapidly on you. For 1 minute, you will have someone who has anaphylactic reactions looking completely normal, and then the next minute they look blue, they're sweaty, they have a decreasing blood pressure with an increasing heart rate, increased respiratory distress, you name it. So listen to your vital signs. They tell a vital story.